Hello and welcome. My name is Mackenzie, and today we're going to talk about addictions. Psst, Mackenzie, what's an addiction? Well, person on the other side of the screen, I'm so glad you asked. The official definition of addiction, according to the American Psychiatric Association, is a psychological dependence on one or more illegal drugs. But some psychologists are taking a broader approach to their definition because addiction encompasses more than just drugs. For our purposes here today, let's define addiction as a solidly established, adaptive, and generally problematic behavior, with the presence of a physiological or psychological component that creates a dependence and a resistance to change. Which is from a book that was published in 2018 by Mr. Carlo DiClemente. So thank you, Carlo. Okay, so we know an addiction is a problematic behavior that comes complete with dependence and resistance to change. But what kind of addictions are we talking about here? Well, you can develop an addiction to alcohol, caffeine, ecstasy, inhalants, nicotine, opioids, sedatives, steroids, stimulants, or painkillers, and a partridge in a pear tree. I'm getting buried over here. But seriously, those are just the drugs. Not to mention addictions to things like gambling, sex, shopping, eating, and a whole slew of other oddly specific things that you can find on that show, My Strange Addiction. Psychologists are constantly studying the human mind. That's why we know all of those substances and behaviors are addictive, because they cause a large amount of dopamine, or your happy hormone, to be released into your blood while your neurons are rapid firing as your pleasure receptors are going off. In layman's terms, it just feels great to be high, and people want to keep feeling that euphoria, so they keep taking the drug or doing the activity. But when they stop, they come crashing down from that high with painful symptoms that leave them feeling so low they have to take the drug to feel normal again, and that cycle just continues. But just because it feels good doesn't mean it is good. And it's a really rocky road to recovering from an addiction. There are a lot of factors that go into addiction, like the amount of exposure you've had and your genealogy, which means everyone's recovery is different. But this is important because it's affecting a lot of people. One article from the APA said that more than 40 million people in the United States over age 12 suffer from nicotine, alcohol, or drug addiction. And only about 10% of those people are receiving treatment. So even if you don't have an addiction, you're still being affected, because alcohol-related problems cost our society $250 billion in just a single year. Why does it cost so much money, you ask? Because rehab centers seem to have a revolving door. The truth is that being out in the real world is hard, and there's temptation everywhere. Even with recovery programs like counseling, therapy, and medical treatments to help addicts deal with their withdrawal symptoms, it's hard to stay clean. And stigmas and stereotypes about getting help for an addiction prevent people from reaching out because they're embarrassed. But they shouldn't be embarrassed. Addicts are just everyday people struggling to stop a habit that makes them feel really good. And we can't blame them because we all want to feel good. So this is relevant to all of us, because many of us may know an addict and be clues to the signs that they need help, or we may not be able to identify the symptoms in ourselves. That's why it's important that psychologists continue studying addiction, because understanding the way addiction affects us individually can help us move towards a more effective recovery option in the future. Ultimately, addiction is about more than drugs. It's a very broad topic, and it's more common than we think. I see you over there with your caffeine addiction, but unfortunately, it's going untreated. With psychologists making progress every day, it's good to stay educated so we can help where we can. I hope you learned something, and thank you so much for listening.